wherever, if you're set up there, that's fine. We can talk like that, whatever. Okay, welcome back, folks. We are going to hopefully complete our first markup, our initial markup of page 545 this afternoon. So we left off on line 9, section 2, which is on page 5 of version 1.1. For anybody online or in the audience here who's following along, that you can find that on Tuesday's version of our webpage. So
I apologize. Can you repeat which page in line 4?
that's okay. It's page 5 and it's line section 2, line 10. Yeah. So this is a completely new section because this is talking about what the commission is going to do based on the advice, remember, from the advisory panel. So I think that that's probably something to be clear about. The commissioner's not just acting unilaterally, which some of the feedback that we have received sort of infers the commissioner is not infers, kind of comes right out and says commissioners got total unilateral. I know.
Well,
He gets
It's
to
an
take the
advisory.
It's an advisory
Right.
recommendation. Yeah.
The
So-
authority.
Right. And before I move to that, I just want to make sure, did that last one get posted on today's, Lori? The feedback, you told me it was posted and I didn't look at it. There was another
Yeah.
email that was
I'm
received.
having some issues with posting.
Oh,
We were
okay.
told we could post more documents and now I'm seeing they're not showing up. So I'm
Gotcha.
gonna save them as PDFs and repost.
Okay. So we received another piece of feedback today that will be posted on today's version of our website. So so sort of to summarize the pieces of feedback around folks who haven't been like 100% supportive of the bill, it really kind of stems around the commissioner having that sort of authority to do that, quote unquote, on his own. And so so we'll get to that. So that's kind of the first line, line 11. But let's look before we do that and talk about that issue. Let's look at the
Yeah,
things
well,
that we
right,
should
because-
consider.
All right, I was just gonna say,
Yeah.
because line 11 itself, what he's issuing is recommendations.
Exactly.
And I think that's.
The whole thing is recommendations.
Right, and what's the effect of the recommendations? The effect is that he can order the drugs, get cheaper prices.
And then
insurers
companies
have
pay for
to
it.
pay for it if a parent or if an adult wants them.
Correct.
Those are I think those are the two impacts of the recommendations.
Yeah.
Yeah. Okay.
Yes. And, just again, to be clear, these are only recommendations. It's not changing anything in any current statute that says any particular vaccine has to be provided prior to anything or as a result of anything. These are recommendations, and you just eloquently summarized it. It's so that insurance companies will pay for it, so that pharmacists can administer it, and so I think that there's 3.
Oh, right, who can administer?
Who can
Yes,
administer it?
Right. which one?
Pharmacists can administer it, and I just lost the second.
And
one you said.
the accessing.
Oh, and the
Insurance
access,
pay for
right.
it and accessing the lower price.
At the lower prices, right? So, so let's look at the 5 things that the commissioner will be making recommendations regarding. So it's the immunizations that children and adults should, it doesn't say shall, but I have a question about that because, Ledge Council doesn't normally like to use the word should.
Shall and may are both funny fits here. Obviously, we don't want a shall. But I guess we could say may receive, but that almost indicates
That they might be getting them.
that they might not get it.
Yeah,
Yeah.
Depending.
It's right.
Recommended to,
Right?
What was
well,
that?
you're repeating recommendation, which you're not supposed to do.
The commission shall periodically. Yeah. Recommendation.
Yeah. I actually like which immunizations children and adults are recommended to receive.
To receive?
Yeah,
Even though it's using the word twice. which
Yeah.
is technically-
I know, it's not good
I think it's
structure, but
okay.
it's
Yeah.
better than should, I think.
Yeah, I think so too, yeah.
Uh,
Well, we do recommend it again.
Again.
So that's fine.
Yeah. So the,
The age at which each child, each immunization is recommended to be given.
Right.
What was that? Sorry.
Number two.
Oh, we were on number one. On number two, I would,
The age at which each immunization is recommended to be given.
yeah,
I realize that we're using recommended a lot, but,
but the whole list sort of got.
Well, it looks like every one of them almost has
Yeah.
at least been
Yeah.
switched around, yeah.
and I would say on number 4, to insert the recommended amount of time between doses of an
Yeah.
immunization. Doesn't have any recommendation in that one. Then any other recommendations? And I would say, instead of ensure, I say, I think I'm gonna ask Jessica about this. I think that we can, I think promote would be a better word, because we can't ensure those things. Do you see where I'm saying, Katie? I'm
17.
Yeah.
Got it.
I had wondered about just taking out to ensure and just to say necessary to maintain public health, but
But then it's still necessary to maintain it and, yeah.
I'm sorry.
I'm just voting.
I'm sorry, promote is better.
Yeah.
Okay, okay. So that's A. Are there any other comments about A? Okay. Prior to issuing recommendations, the commissioner shall. So this again, it means the commissioner can't do it on his or her or their own. Consult with the advisory council. Also to consider recommendations by the CDC, as well as these are the professional organizations in the that rely on the science of doing this. Anybody have any suggestions or edits to that? Okay, moving on to C.
I'm sorry,
Yes,
just back
that's
on
okay.
line 6. I guess it covers it under any other organization, but if a name was to change of one of these, they could, because then it would capture it under any other organization.
Could just say, well, we're gonna have this one.
Yeah, yeah. Or if one ceased to exist, another one could its place or whatever. So, okay, never mind.
You all set?
Oh,
I
yeah.
know, we did, didn't we received, who was it from? I think
The nurses.
yes, yeah.
That was about being on the
Membership.
advisory council, which we
Oh,
got.
okay.
Yeah,
Okay,
yeah,
okay.
okay, all right, so we're on C now. I have to go back and look up that, okay, let's see. This is the immunity from civil and administrative liability. Go ahead.
So, yeah, vague recollection, and maybe it's a question for Katie, or if you know it. This seems to mirror what exists currently in federal law for those who follow the CDC recommendations, that we're just saying, and now that we're issuing the recommendations, you have that same immunity.
I would have to confirm that. I don't know off the top of my head. I pulled the language from the opioid antagonist statute.
I'm not expecting it would be word for word, but yeah, it would be worth checking, because I think that is current law in terms
I
of.
will take a look.
Okay. And just so you know, the Judiciary Committee is going to do a drive-by and they're gonna look at that one section on Wednesday morning, I think, sometime, I don't know, Wednesday, they're gonna be in contact.
Okay.
He said they just need Katie. I said, yeah. If you need to bump us to go there, that's fine. Okay, and then, the D is something that was a total new concept to me that came up during the COVID, immunizations this fall, that the commissioner can issue a standing order. That means that anybody can go in. The order is applying to the populace.
It's like a prescription for
For
everybody.
everybody,
Yeah.
right? I'm just
That's
like,
exactly how it was described to me by the chief prevention officer.
yeah, I was like, really?
Madam Chair, you had a comment about subsection C from the Health Department. I didn't know if you were taking comments.
Yes. I don't, what is that? Go ahead, Jessica.
Oh, we wanted to just weigh in on the provision you were discussing with regards to the immunity and the current federal system for the vaccine injury compensation program. And so I'll let my colleague Lauren Lehman jump in on that explanation.
Lauren Lehman, General Counsel for the Department of Health. There is federal protections. There's not actually immunity right now. There's an entire kind of court system at the federal level where injuries can be reported and compensation provided to families, but the provider then is insulated from direct tort liability. This would provide comparable protections as long as they were acting in accordance with state law and or with the recommendations and were negligent, et cetera. So it still provides that protection where they have to act in accordance with the recommendations and all the expertise and the standard of care. And if the federal kind of insulation tort system isn't available under that vaccine injury compensation program, this that protection here. And we think it improves access because doctors, providers will be more willing to act in accordance with Vermont's recommendations in those situations.
So that sounds like what I was thinking of, that it is analogous, but that raises another question that you're reminding me. That federal process incorporated into it is an avenue by which someone injured can get reimbursed because they can't sue the provider or whatever. And we wouldn't have something like that available to, but would they still have access to the federal tort process?
Yes, it's very complicated. I'm gonna talk about it. The vaccine protections at that federal level are often limited to the vaccines recommended at the federal level. So to the extent the state recommendations were different from the federal, there'd still be, somebody can always go to court in the state. They can, they might be, the provider may be immune, but there might be other avenues of manufacturing, other options. So there's always still options for compensation, federal level, this level. But this provision specifically insulates the healthcare provider as long as they're not being negligent, as long as they're working in accordance with the state recommendations.
And I'm not suggesting we wouldn't want that, but I'm just wanting to understand and have this be clear on how that does or doesn't change existing. So there's sort of a quid pro quo, if you will, in the federal law. You can't sue, but you have an avenue of getting compensation. And this change would still allow that existing process for things that Vermont has that are the same. But when we have ones that are different, that would not be available to them. But this group of people would be immune from a tort claim unless they were grossly negligent or reckless. Okay.
Thank you. Thank you for that clarification. I'm sorry, I didn't see a hand or a nod or whatever.
No worries. I'll try to be more.
I see you switch sides, so.
No, I was trying to see if that helped.
Well,
That's why I moved back here. So you have
Representative-
a very line of sight, and then I actually. can do this.
Representative McGill's not here today, so I see I don't have a direct line. I mean, Representative McGuire, yes, sorry. Bill's here. Okay, it's all good. Okay. And the standing order and how it relates to pharmacists, we're going to hear from the Office of Professional Regulation on Tuesday afternoon, so. Okay, and then we're pulling in the piece from the OPR bill. I don't know where,
Those will be standalone sections.
it'll be a standalone section, okay.
Two standalone sections.
Esme?
One piece here with the section B is, wondering how clear we need or want to be about incorporating the advisory council here. Or if prior language above helps to sort of just have that assumption that they're gonna be involved in that conversation.
About who should be under the standing order if it changes.
Yeah, or about making that call, that final
Yeah.
call. Because it seems like alone with the others paragraph, the commissioner has a lot of power, but which is good, but also I think the incorporating and making sure that the advisor council is really woven in there.
What I'm wondering about is, I'm, because it is an advisory council
Yeah.
and, but what I'm wondering about is if they're, I'm not anticipating it, but sometimes you have to anticipate the unanticipated. If there is some sort of thing that we should insert that if the commissioner issues a recommendation that is different than the advisory panel's recommendation,
Yeah.
that there's, I don't know who would be notified or who would be.
Right.
But it feels like there should be I guess, just a little bit of.
Yeah,
um,
yeah.
Governance
I like that.
structure, yeah.
Report to their boss, the governor.
No.
No. No, I'm wondering about maybe the medical practice board or something, I don't know.
Okay, I was also, as you were saying that, thinking of like some kind of note on public education documentation about the schedule, like, so it's noted for the public somewhere.
Oh. That there's a disclosure to the public.
That's important.
Back to you. Oh,
Just
sorry.
a second, yeah. So, okay, I like that idea, so that there's a provision for public disclosure if the commissioners public recommendations are differ from the advisory panels.
Okay.
Yeah, go ahead, Ann.
So back to the original question about the commissioner having to consult. Well, current language does, the only part where the commissioner shall consult is only to coming up with the recommended ones. So I mean, I like the idea of saying, again, to really make it clear that this is not commissioner just unilaterally, that in issuing a standing order that would change which professionals can do that there be advice from the advisory panel. Maybe it doesn't need to be a whole section, but maybe incorporated into the duties of the advisory panel. But I like the thought you're raising, that,
Spirit.
yeah, the spirit of it, right, that if the commissioner can issue the standing order, that there be input from the advisory council.
The term recommended immunizations, if we go back to the definition, it does refer back to the process that's set forth in this section. So it says, these are recommended immunizations, recommended by the practice guidelines for children and adults established by the commissioner pursuant to section 1130A, which is what we're looking at. So the definition of recommended immunization itself does refer back to the process and not just one person's recommendations.
And the process
The process
requires input.
consultation.
Okay, then that, yeah. All right.
Brenda?
Instead of like the Vermont, the advisory panel, how about federal recommendations?
Well, we say.
Yeah.
Line one.
Yeah,
Line
Line one
one,
on this page, on page
on this
six.
page.
Consider
Okay.
recommendations
from the Centers
issued
for
by.
Disease Control. That's the
Yeah.
federal.
And that would be federal?
Federal,
Yes.
yeah.
So now I might be in la land, but so parents are notified before a vaccination is given. This is all new to me, so.
It's, vaccinations are voluntary.
Okay, so parents are notified.
Yeah, parents have.
And that's in here.
They're not notified. Parents actually have to
Have to
seek them
give
out. for
consent.
their
Oh,
kids.
good,
They have to- and they have to
Okay.
consent.
I know, I told you, I might be way off.
No, they have to give informed consent.
They do have to give informed consent, and it is in here that federal recommendations.
It's right
I was
there.
thinking of
Line one.
Ellen with her, the panel, so I didn't know.
Yeah, it's page
Consider
6.
Recommendations, okay, thank you.
Okay,
Sorry, this is new to me.
yeah, go ahead.
so
We're in discussion. You
I don't
don't
know
need
if
to
this
raise
is
your
a
hand.
Oh, I
right
didn't know
place for
that.
this,
Yeah,
but just
everything,
kind of
say.
I'm wondering what other members think about, like something in the policy that talks about educating the providers and the public about the discrepancy that there might be between the federal recommendations and the Vermont recommendations, because we went through that with COVID, with the COVID vaccines just in the fall, where there was a standing order in Vermont, but many providers were not following that standing order because they were worried about federal guidelines, federal funding, federal whatever it was, but there was a lot of miscommunication, and the Vermont Medical Society brought that up in their testimony, that there is a lot, and they're thinking about how to do that, but I wonder if, like, we kind of say, it's also the responsibility of the department and the, all the stakeholders, advisory, I don't know how we would want to frame it, but just to kind of make it explicit that there needs to be, because there'll be discrepancies in what these providers are hearing from the feds and us and the state.
So, do you have a suggestion?
I don't, but I can think about it.
Well, so along those lines, I'm thinking of now, why this is being done so Vermont has the right or takes
Process,
authority.
yeah.
But in 3 years, the commission might recommend the CDC's.
We're gonna have, at the end, we're gonna have a sunset of this.
Oh,
So
I
that it
see.
will need to be reconsidered after, we'll decide on what period.
Could we state something at that, at the sunset moment or something like that?
Well, I think what Ray is getting at is each time the commissioner makes a recommendation, if there is a difference between that and what is recommended by the CDC, that providers need to be informed about that.
I see, yes.
And that's the medical society said, it was, we were in new territory, we're in new territory.
I know,
So-
I'm lost.
Yeah, we're in new territory, and that, we had a dry run,
With the
in the fall with the
COVID, yeah.
COVID vaccine. But, we heard from the commissioner that, felt like we were, we did what we felt was the right thing to do. And this change in statute backs that up. I guess I'm trying to figure out whose responsibility is it? Is it the medical society's responsibility? Is it the department's responsibility? Is it the physician's responsibility themselves to be seeking out whatever the recommendation is? I'm trying not to overburden the department on something that
Yeah, and
people have professional responsibility if you're a physician.
I would argue it's professional organizations and the professionals themselves, and would not look to your point.
so from a consumer perspective, I guess I would ask the committee or the department, where would a consumer go if they they know what the state law is, like with the COVID vaccine that was authorized in Vermont? I knew I was, I should be able to get it. I should be able to access it, right? I knew that. I'm a legislator. I knew what the law was. I knew what the rule was. But I had to go to so many different layers of providers to get that vaccine. And finally, when I did get it, it wasn't under the Vermont standing order. It was under their interpretation of what the federal government said. So where would me as a consumer go if I'm denied access to the immunization that I should have access to under the standing order? I guess that's the
Right.
question.
So it should, and it could be something that was in the statute or maybe just clarified with the commissioner, that the Department of Health website.
It should be
Should-
posted. I
should
can't
have
remember
a
what it was. Was
prominent-
it posted during the COVID?
It was
Yeah.
posted,
Yeah.
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 And there could, and public outreach, that's where you look.
That's-
to find access and to understand,
Okay,
this is
so,
the website.
so I think probably at a minimum, we should say in here to be explicit that, the, commissioner's recommendation should be posted, there's probably other things about the commissioner's recommendation, like if there are any,
And any changes should be
You
prominent.
post the immunization schedule. It's available on their website.
yeah.
Okay.
Yeah, I'm just trying to, I don't want to be too prescriptive. but
Yeah, no, I
wanna, maybe we just say relevant information regarding the commissioner's,
Right.
immunization recommendations to be posted on the department's website.
Can you add something like efforts to like, you know, sometimes I see things like ads on social media, get your.
And how to
Oh,
access.
Things
And how
like
to
that.
access.
Public outreach is adding that.
No, that's the.
Or,
Oh, yeah.
or point of service, where the service
Where they
is given.
And where
Yeah.
can you, where you can get it,
Where-
which is what you were.
What's easiest, I like
Yeah.
what Ray's touching upon.
Yeah.
So, yeah,
The website should list it and should also,
it should also be at
Identify-
the point of service.
right, identify.
Oh, well, they pull it down now. Probably
Oh,
it's not, it's probably not on there now, right?
Well, no, but any vaccine.
No, I'm just thinking about if we could look at the website, the health department's
Oh.
website right now and see what they posted for COVID, but that's probably that's not. It's not.
Well, on there.
Is it still on there?
It is.
I'm
Okay.
looking right now.
COVID and others.
too. All right, well, who?
Falling
So
does not
racism
have to be a
finds it
normal
first. I'm
part
not
of
looking.
aging.
Vaccine access is listed on the flu, COVID, and RSV vaccine. That's a section of the homepage.
Does it say
I'm
where to
not
get
looking
it?
on the homepage, I'm
Uh,
not seeing it.
Let's see, if you don't have contact your healthcare provider. If you don't have one, call 211
Where is it? That's on
I
the
think
cover
that's
page.
fine then.
or contact the nearest federally qualified health center or one of Vermont's free and referral clinics. And there's links for some of those.
There's links.
I think
Where are
that's
you seeing that?
fine
'Cause I'm
then.
not seeing that on the.
So Ray, I'm confused. So,
Okay, just a second, let Ann ask the question.
oh, I'm sorry.
That's okay.
Right.
I'm seeking Doug to respond to it because I'm not.
It's Department of Health / disease control / this one is respiratory illness because it's flu.
But what- Did you just do a search?
It's not
I
on
was just
the
saying-
cover page of the Department of Health. Right.
We
I did
did
a Google search.
Oh, that's, no.
Yeah.
I just went to, what do people get if they open the Department of Health website?
That's.
And they don't get anything highlighting. And in fact, we'll note to the commissioner right now, the statement about the CDC change in recommendations, what it says on, there is something right, there's a thing, statement from Vermont Health Commissioner Rick Hilbrand. And it doesn't say about the CDC changes. So you wouldn't have a clue about that. But it seems to me that that's where you would want something to a direct link, like the other direct links they have here.
So
on-
I think that we should just indicate to be prominently displayed on the department's website.
Yeah, that's,
Yeah, that's perfect.
yeah, but
How about also at the point, some people don't have a computer or don't even know how to use one. So wouldn't it be at the point, like at the set, like where they go?
At their doctor's offices or
Right,
whatever.
not just the point of service.
I worry about us creating a whole new public media campaign that would have to go on forever. I mean, this has a sunset, but this
And would
is basic
cost-
recommendations.
costs a lot of state money.
Yeah, it's a lot of state money.
Uh-huh.
I worry about its ultimate success. I think this is
I think the
conversations that
website is.
healthcare providers have with the families that they serve.
How about we insert a QR code into the bill?
Statute.
All right, so I think to summarize, we're going to leave it at prominently displayed on the department's website. Okay? Okay, now we're still on page 6 on line we did that section.
Yeah,
We're 19, that's nothing new for us.
that's, yeah, what.
Okay, we're on page 7. All right, so this is the advisory council, and membership, and this is, where we heard from the advanced practice nursing people that they would like a seat,
It was two
two
groups, yep.
seats. Yeah.
Advanced practice nursing and I forget the. There
Um,
are two types of,
So that, I forwarded that information to everybody. What are your thoughts about that? And I want to know what the department's thoughts are about that. Or maybe I'll ask the department, I'm going to ask the department first.
There's a definition, in the statute already that was referred to at the bottom of the last page, healthcare professional.
Yes.
So our suggestion would be to add a seat for healthcare professional. And that could encapsulate APRNs, and other, healthcare providers licensed. And we recommend they be licensed in the state of Vermont because in this situation, because there's different scopes of practice for a lot of advanced providers depending on state.
I'm not sure that totally gets at what they are looking for. I mean, I understand that the definition of healthcare professional includes those people. But it also includes physicians and other people. And so it wouldn't guarantee that they would have a seat at the table.
We were trying to avoid having a seat for every professional, but.
I was about to say there could well be others who think who's, it would be of value. And then you end up with a group that's too large to be effective and.
And support recommendation to add the board of nursing, a seat for the executive officer of the board of nursing.
And would suggest that there also be a seat for the board of pharmacy. Executive officer.
So
That
1,
was up there. Maybe that was on the
2,
first one.
3, 4, 5, 6, 7, 8, 9, 10, 11. We're never going to go with an even number. So we're either going to be 9 or 11.
So they just recommended 2.
Right. So I think we could say something about that, the definition of the healthcare professional that doesn't duplicate one of the
Mhm.
previous, so we already have a pediatrician, I know I've seen that worded somehow
Yeah.
in a
Other
different bill.
bills, yeah.
Yeah.
Oh,
Do you know what I'm getting at, Katie? Okay. So, so I think we'll go with the healthcare professional because that includes it includes the advanced practice nursing. But just to indicate that we won't duplicate somebody who already has a standing on the board.
Who does the appointments for the Board of Nursing, Board of Pharmacy? For the Board of Medical Practice, you have the governor.
But at the Board of Nursing, aren't we saying a position? Didn't you?
Sorry,
recommend a position?
APRN
It
appointed
would-
by,
I think it's the executive officer of the board of nursing and the executive officer of the board of pharmacy, and that one could, depending on what you're doing with designee elsewhere. It could be the executive officer or designee.
Appointed by the,
okay, got it.
appointed by
Designee.
appointed by themselves, right?
Yeah.
You do want designee, executive officer or designee in both places?
Yeah, because I mean, they could recommend, somebody else.
And then the appointment for the healthcare professional.
That somebody has to appoint that because they don't have an organization. What did we do for the other ones where
Governor,
they're all
I've got a
government?
governor.
unless it's a
Okay.
specific office.
All right. Governor.
Yeah.
Okay. Just make sure that we don't end up with an even number. Because I just realized it continues on page 8. All right.
Which ultimately,
Says,
commissioner can, or let's see, what's a representative, and any other persons deemed necessary by the commissioner.
Mhm.
We actually would
Do we
now.
really need that?
I
Do we
don't
really need that?
No, because now it's more open with other, and other healthcare professional, because otherwise that does put us even. We just added 3 and 9 plus 3 isn't even. So. if
I'm just
we-
looking to the department.
We need to get back to you on that. We need to consult with the folks that work with the committee, if that's all right.
Okay. So.
12. Because 6 is 2 individuals. Did you catch that?
Yeah, I did, yeah.
I
Two
did, I missed
individuals
that, that's
too?
right.
Isn't eight?
Oh, that's right, so that's.
Agreed.
Oh, yep.
Yeah, right?
So
Right.
it's
Two
two.
is 2 people.
Okay, I missed 8.
And number 2 is.
Yeah, so that would be. Yeah, I think that would be okay.
But, does that even mean one from each?
You got 13? Okay.
They have to mean one of each.
Yeah, I think we're gonna go with a representative of public schools.
1. That brings us back down to 12. Is that okay?
No, I think she needs to scrap independent schools. So what you mean?
Yeah.
Yeah, but it said
Number
both, which meant there were
Number
2 people, so now we've lost a person. Although maybe you didn't count that as 2 people.
No, we got 13 when we counted that as 2. So now that brings you back down to 12.
Oh, I'm not sure. that
Oh, did I do my
counted
math
it as
wrong?
two.
You counted 8 as 2 because I don't think
Okay,
it's.
let me count again.
So we're taking out.
And,
Actually, number 8
all right,
could
all
be
right,
construed
let's
as.
just have quiet just for a moment, while we, by Katie counts, so we
I
can.
got 12, but you know, I would
Oh,
invite other folks to come.
So we all count together.
In your drafting, can you separate out human services and education on number 2? Just so we don't do exactly what we just did and count them as one.
I have 13 up to and not including 8, however that's interpreted.
Yeah, 2.
5, 7, 8, 9, 10, 11, 12. It is 13. 13.
Do you,
Oh, perfect.
are you striking the new 9, the old? Yeah, the new.
That's, we're taking that under, they're gonna get back to.
Okay, I'm
13
sorry.
is eliminating 8, and I don't know if you want to totally eliminate it or change it. When I, counting up and
I'm not
getting
eliminating,
13.
I'm just changing it to public.
Right, okay, so then there's 14. I got
All
13,
right.
not even counting.
When it's redrafted, we'll count them.
Yeah. it'll be
Okay.
much easier.
In the next version, we'll count them. All right. The count, so,
3 hours.
so, I know.
Of interest.
Realize how silly we were looking.
Yeah, don't continue this
Yes,
on live.
we don't need to consider that. Okay, so so then we're moving down to the duties of the council.
Here.
So this just adds, including any advice regarding the recommendations. To be issued by the commissioner.
This is
Oh,
where you
right.
wanted this to be rewritten to clarify, because you were very confused.
No, that was back before she took out a couple of things.
Oh.
Including advice. Oh, yes, you're right. I had 2 places. This was the second place. Yeah.
Oh, it's circular.
It's circular and it makes it sound like the advice comes after the commissioner makes the recommendation.
Oh, right, advice regarding those issued by.
Oh,
Because it's past tense.
Mhm.
Yeah.
You could just say, including advice regarding recommended immunizations
Pursuant
as
to.
defined in.
Yes, that's better.
Are we being clear enough about how advice is being delivered and to whom very specifically? I know it's in schools, but like,
The advice of this group is only to the commissioner.
oh, I see. Separate from number 1, obviously.
Yep.
Um,
And is all existing other than clarifying that it includes the immunization recommendations.
So. can you
Okay, so just to summarize, pardon?
I was just hoping we could get read back what we've changed.
I was just gonna say, I was just
Okay.
gonna, go ahead, Katie.
So the council shall, jumping down to 2, provide any other advice and expertise requested by the commissioner, including advice regarding recommended immunizations as defined in section 1130.
Period.
That sounds good.
Okay, now we're on to this question about administrative, technical, and legal. And now we have an attorney here. So this looks like it was making it consistent with the previous panel. And we had questions about whether or not that was going to be sufficient assistance and whether or not we should be making the previous panel be consistent with this one.
Thank you. Lauren Lehman, General Counsel, Department of Health again. We have concerns with the legal advice in particular to committees that are not under the authority of the department. Because when our client as the, as the lawyer there, under our ethical obligations, the client is the department. And so if the committee's interests are different than the department's interests, it's difficult to know. I don't want to provide them with biased advice or my client with biased advice. So or to represent two sides of a coin. So providing legal assistance to these committees generally is a challenge that we've had to navigate. So I'm hesitant if given the opportunity to remove one of those concerns, that was what we were doing here.
It seems to me that because they're an advisory committee, I'm not clear why legal assistance is really needed. I mean, if they make a recommendation of some sort, that's not legal or not within their authority, then the department's attorney is going to say,
It will
well,
advise.
this one is not
We'll
within.
advise the commissioner.
Right, we'll advise the commissioner. So doesn't seem to me, I think they probably do need technical assistance, but
So I understand the argument, and let me pose a question, sort of a hypothetical. So if the group asked for an interpretation of something that's written on the federal level, is that something that would be provided? Would that be considered technical? If they're just looking for the words up on the page and they want to know exactly what those mean from a legal perspective.
In that situation, I would likely speak with my client, who's a member of the board or a member of the committee, and then they could share their understanding of it and walk through, so it's not constituting legal advice.
It's not you delivering it.
It's not legal advice. And they know, the committee then knows it's not coming from a lawyer. They're not interpreting it as legal advice. I think the situations where legal advice is needed often is in open meeting laws and public records forums. And in those situations, what we've done so far is to provide overall guidance. And then of course, we handle the administrative functions. So we make sure that the notice is provided, that there's open meeting access, recordings are provided. So that's how we've handled that in the past.
Okay, so what about if we compromise and put in both places administrative and technical?
I would be fine with that, or you think so?
Okay, let's do that, Katie. And I think we're going to be putting back in, but no less than once per year.
yeah.
Like why have it if you're not going to meet?
Yeah.
I wonder if it speaks to that. I don't know anything about the council, but looking at the website, there's currently only 4 members, which doesn't seem to be a full complement of what the statute is. So I guess it's has not been particularly active, but we are asking something very different now. So
Exactly,
Yeah.
so
much want it to be active.
it hasn't had to be active in the
Yeah.
more recent past, or distant past. Okay, so elect a chair from its membership, constitutes quorum. I don't know if somebody's going to raise the issue of payment. I mean, all of these people are in professional positions.
A lot of times it's specifically, when it says payment, it says payment to any member who is not in the capacity of their,
Yeah.
That's usually like people with experience.
Right.
Yeah.
I don't think there's anyone there that's
And I had a question.
be unpaid in their job in terms of participating.
Katie, do you think we need to add anything?
Given this list, and the fact that it's that it's all professional people. If I don't feel strongly about adding it and it's operated without it for a long time. But it's a policy decision, or we might get over to GovOps and they might.
Well, that's kind of what I was thinking, although John Gannon's not there anymore. So again, that was, he was always a nitpicker on
Well,
that.
my first year here.
Yeah, well,
Opioid.
yeah, I know.
So.
Yeah.
From past boards I've been on, when there's a lot of membership, where it says the council shall select a chair from among its members. Do you think with such a large amount, it'd be better if the commissioner picked the chair? Because it's going to be harder. And they all don't know each other, where the commissioner would know more what each brings to the table. I've just thought it.
Yeah, I mean, it's an interesting thought. But generally in these kinds of councils, there will be somebody who kind of comes forth as a leader of the group. And I think that's, sometimes we say the commissioner shall call the first meeting or something like that.
Yeah.
But this is an existing, it's not a new one. So I think it's better to leave it.
And then
Well, in
what,
this case, because its function is to advise the commissioner, many advisory councils
oh,
are doing
correct.
something different.
Correct.
If they have the
That makes sense.
commissioner then.
So, but then that brings me to this, the council shall convene at the call of the commissioner, and you took out the time.
Or we just had.
No, we just put it back in.
Oh, you did, that's what I missed, and I'm thinking, how are they gonna pick a chair when he might not call a meeting?
No, we said.
Oh, you
after
did
meeting.
add it back in, I was hoping for that.
Yeah, we just did just a second ago.
I missed it. Thank you.
Would there be
You're welcome.
any point in excluding the commissioner from being the chair, since the purpose of the commission is to make
Yes.
recommendations?
Yeah, that would make sense.
Right. Right.
Yeah.
But we're not going.
No.
Yeah. Okay, and now we're moving into other policy in the financial regulation area, and we will be having somebody from DFR. Yes, okay, good. Yes, they've been actually following along. They were on our feed on Tuesday when we took testimony. So the change here is that we're referencing it back to the statute that we were just amending instead of listing,
As
okay?
defined it,
As
right.
defined, right, so it's not only the CDC, it's the CDC or the commissioner.
Okay.
Okay,
Does it say the CDC or the commissioner, or is it just the?
as defined in 1130, which is CDC and the commissioners considering that, yes. And then this is the next thing is under, insurance, health benefit plans. It's again, saying that these are covered services, shall not impose any co-payment, co-insurance or deductible. And that's what is current law. Okay, so again, we're just changing the language to say as defined in 1130. And we do want to change the effective date to effective upon passage.
If you'd like to look at that OPR language, I can pull up my draft.
Okay, that would be great. So there's a current bill, the miscellaneous Office of Professional Regulation bill that is in government ops that they took the pieces that are relevant to this bill and is moving them into this bill.
Okay, so this is an unedited draft. We have highlighting because I highlight all the changes between the drafts. So these are two sections that I dropped in from the OPR bill and renumbered. First, clinical pharmacy and prescribing.
Can you
Can you make it bigger?
Yeah, I was thinking, can I get rid of this thing?
And you can also stay out there.
Is that helpful?
Mhm.
Okay. Pharmacists may prescribe in the following contexts. Then we have the state protocol. A pharmacist may prescribe, order, or administer in a manner consistent with valid state protocols that are approved by the Commissioner of Health after consultation with the Director of Professional Regulation and the board, and the ability for public comment. We have a whole list: opioid antagonists, epinephrine.
And those are all current statute.
Yes, thank
Yes.
you. Dietary fluoride supplements, that's current statute. And then in Roman numeral 7, immunizations for patients 18 years of age or older. I should say that this had said vaccines in the OPR version, and to be consistent with the language change that the health department brought, I changed it to immunizations. And same thing in Roman numeral 8. For patients 5 years of age or older, influenza immunization, COVID-19 immunization, and subsequent formulations or combination products thereof. Then we have similar language in 7. Oops.
Can I ask a question? Why are we being specific about the vaccine if they're not saying as recommended?
That's probably an OPR question.
Okay,
Well, one, they weren't working with the definition of recommended immunizations
okay.
in their bill. So let's see, immunizations. Yeah, I guess we could just say recommended immunizations as defined in.
Right, and you wouldn't need 7 and 8.
Yeah. Well, for patients 5 and older. Well, so in 8, it's limited to the number of immunizations. So I'm not sure why they're specifically calling those out.
Okay, all right, we'll ask them.
Okay.
We'll ask them. For 7 though, couldn't it say as recommended?
You could say recommended immunizations as defined in 18 BSA 1130 for patients 18 years of age or older. Or if there is no need to call out specific immunizations for patients 5 years of age or older, then you could just have 7 and get rid of the age reference in 18 and just say recommended immunizations, and that brings in the whole schedule.
Yeah, because the recommendations are gonna divvy up among the.
Well, right, and there may be reasons that have been agreed to previously about what pharmacists are willing to do. And it might be limited to those. I don't know.
There might be a reason. Excuse me, this way. I haven't had any conversations with OPR about this language.
We're going to hear from the head of the pharmacy board or whatever they're called as well.
Okay.
Something like that. Are they coming, that person coming with OPR? I think he told me that. Okay.
The next section is fairly similar. This is pharmacy technicians, qualifications for registration. Pharmacy technicians shall only administer immunizations to patients 18 years of age or older. And
So what is that subdivision reference to, what we just were talking about?
I'll just take a look. As established in 18, I'll take a look.
Okay,
And the resulting state protocol, subdivision 2, to patients 5 years of age or older. And then it's the same 3 listed out. And there's language pursuant to the schedules recommended by the CDC. So that is, the proposal is to remove that because recommended immunizations, if you choose to use that word, pulls in the whole consultation process. And then when a licensed pharmacist who is trained to immunize is present and able to assist. And then subdivision D is proposed to be removed. Pharmacy technicians shall administer only those immunizations that are recommended by the CDC's Advisory Committee on Immunization Practices. And licensed pharmacists are permitted to administer under the state clinical pharmacy protocol as established in subdivision 2023 V2. So I'll have to look at what 2023 V2
Okay.
is. That's it. Then we just have renumbering, relettering.
Okay. All right, so we'll save our questions on why they made the choices that they did until they come in. Okay. And then, so, I think that, on Thursday morning, yes, yes. Oh, it's the Blue Cross Blue Shield Pharmacy Director. Okay. Lori, would you ask the lady from OPR if she wants to bring the Board of Pharmacy person? It's just going through my head. So on Thursday morning now, Katie, it's gonna be on your schedule for judiciary.
Okay.
And I believe it's gonna be Wednesday morning or Wednesday sometime in healthcare.
Okay, that has popped up on my calendar already.
Yeah.
Under which day?
Yeah. And so, we're still gonna look to vote this out next week, probably towards the end of the week, after we get any feedback from those folks. I heard from the chair, although he might, after looking at it, he might want to take a look at it, I don't know, of GovOps. He might do a quick run through of that section that we were just looking at. So this is what happens when you have bill that touches other committees and different parts of the statute. So, anybody else have any questions about what we just did? Okay. Okay, I guess we're good, Katie, I think,
Okay.
on this. That's great.
Thank you.
Thank you, Katie.
Thank you.
Appreciate it. So are we thinking like, are we thinking like Tuesday morning, maybe, or Tuesday afternoon? We'll see
Yeah, I
new
can
version.
have a draft by Tuesday morning.
Okay. Okay, great. And we have you scheduled at some point next week for this. I don't remember exactly what day it is, but. Okay. Okay, so let me find the draft agenda. There.
Oh, while we're still on this subject, I had brought up around trying to come up with a way to make sure that people have access to vaccines as part of while we're talking about them. And I actually wanted people to know I've met with the health department and we're going to have some discussions with Dale around how there may be greater access or we come up with ways to access at senior centers and meal sites and just people that maybe want a vaccine, but really hard for them around transportation or so we're going to talk. And I'll report back and it'll be at some point.
Just for COVID, I mean, like
It
right
was-
at our shelter, and it was often for some folks their first time, like, you know, just being able to access and having that kind of coming to people.
I mean, just remember, we had a lot more resources during.
Yes.
COVID,
Oh, no, I
Yeah.
absolutely understand, but like those kind of points where you've got lots, you know, you can reach a high volume of people
It
in a
could be the
single
local-
event.
It could be the local pharmacist that might come do it.
That's
You know,
Right. And so we'll talk.
Great.
thanks for following up on that, Dan. Okay, just to review, what's up on schedule for next week. So we'll be taking this up again after caucuses and lunch on Tuesday. That's when we're going to be hearing from the Office of Professional Regulation. We're going to be hearing from, that's OPR. We'll be hearing from the Department of Financial Regulation. We'll be hearing from the health insurer folks, MVP, Blue Cross Blue Shield. And then we are going to be doing H534, a walkthrough. This is a pretty simple bill. And when you see the language, if you want to take a look at it over the weekend, you'll recognize it from H91. It is the very last section of H91, well, next to the last section, I guess, after effective dates. It has to do with just the makeup of the boards and what community action agencies are called in statute. It doesn't have, it's a housekeeping thing. It's not,
Right.
there's no money, there's no anything like that.
We discovered the housekeeping was needed last year.
We discovered it in the
Working on it,
process.
yeah.
We were like, why are they called this in statute when that's not what we call them? So that is gonna be a really simple one. We're only gonna take testimony from the community action agencies and from the state, the department, because they're really the only two people or entities involved in that. And we'll be voting that one out next week as well. I don't know yet. And then we're going to be doing a walkthrough and start to be taking testimony on H594. That's Eric's bill on our homelessness issues. So stay tuned. We don't have a witness list for that yet, but we will before we get to Thursday. And then we're having a joint hearing with the Healthcare Committee on Act 119 of 2024. There is a report in our report section that you should read before we get to that hearing. This is on the reimagining of the Agency of Human Services, something they have been working on in terms of a process. This was something Senator Kitchell had put in place before she retired. And so we will be doing that on Thursday. And then Friday, we'll be hearing from additional witnesses, but we don't have them yet. So
Plus some bill votes in there, of course, of the schedule.
yes. And
Our budget, BAA.
our BA, right, we'll be reviewing the BAA memo on Tuesday, and I'm going to be testifying in House Appropriations on Thursday afternoon around our recommendations. So that's what next week looks like. And as you can see, there are we kind of got sections up there, and the ones all the way to the right are bills that we passed out last year. Okay, the ones just to the left of that, H534, 545, 594, and 91, those are all bills that we're working on in process. There will be over the next couple of weeks. And then, we will take a look at, hopefully by the end of next week, we've received the biggest chunk of what we're going to be getting. We'll see if we have any more room left on the board. We'll be looking also at some of the reports that we have coming in. And then, of course, by the week after, the governor's budget will have been released, and we will be starting budget work and testimony on budget work and the teamwork that people are going to do. So we got childcare coming up, and we got recovery housing coming up from the Senate, and we have some DCF child welfare stuff coming up. So we're going to have as I said earlier this week, a busy session. So hopefully the first week wasn't too stressful for folks, and we'll be back at it again on Tuesday. But for now, you get to do constituent work.